Under new business, item A, presentation, Central Connecticut Health District Year in Review.
Good evening, ladies and gentlemen. Let's see, should I be using this one or? Good evening, and thank you for your time this evening. I'm Judy Sartucci. I'm chairman of the board of the Health District. I am also one of your two representatives on the board of the Health District. The other is Art Yopes, who wasn't able to be here this evening. With me tonight, as I think most of you know, is Paul Hutchin, our Director of Health, and also Nancy Brault, our Chief of Environmental Health Services. At your places there, you'll find a copy of our annual report for this past fiscal year, and we'll be just highlighting a few things on that, and then also a copy of our slide presentation. For those who are viewing at home, all of these items can be found on our website, which is www.ccthd.org. Okay. The Central Connecticut Health District was formed back in 1996 by the towns of Rocky Hill and Weathersfield. We currently are the regional health department for 4 towns. Okay.
It takes a bit for the system to catch up.
Okay. Let me see here. I'm going to.
It's on.
Sorry about that. Thank you. Great. Thank you. Next. Yeah. We currently serve the towns of Berlin, Newington, Rocky Hill, and Weathersfield, a combined population a little over 97,000. We're one of 21 regional health departments in Connecticut. As I said, we've been providing service since 1996, 17 years. We provide a broad range of public health services to our member towns. Oversight is by a 12-member board, which is made up of our Director of Health and 11 directors that are appointed by the member towns based on the town's populations. The agency currently employs 8 full-time employees, 3 part-time folks, and they work out of 5 different offices, 2 in Newington at the Senior and Disabled Center, and then 1 at each of the 4 town halls. This is just a brief summary of our financial status as of this past year. Over $400,000 or over 44% is contributed by our towns. About a third of our budget currently comes from grants, both federal, state, and some private. We generate revenue from our programs, approximately 22%, and these are the fees that we charge for our services, for inspections and licensure, as well as that we generate from our flu clinics. Salary and benefits make up about 80% of the expenditures, as it would for an agency of our kind, and about a little over 10% of our expenditures go for the actual program operating a budget and such. 3 years ago, our board put together a strategic plan, which we are approaching the end of that 3-year period. We identified 5 major goals, which are listed here. The first related to our natural and built environments. The second relating to health promotion activities at any age. At each stage of life. The third related to our assuring internal readiness to be able to respond not only to public health emergencies and threats, but those including environmental and infectious disease as well. Our fourth goal there is to improve and maintain the quality of services provided by our health district. And then lastly, strengthening our agency infrastructure. And this includes such areas as actually assuring a well-trained, well-prepared workforce, adequate services, resources, headquarters, that type of thing, appropriate IT and other kinds of technology. Okay. Paul will go into some of the details right now regarding these 5 goals.
Thank you, Judy. And again, my name is Paul Hutchin, Director of Health for the Health District. Our next few slides will follow the goals that Judy mentioned. And again, we're really giving you a synopsis tonight of our annual report that we've left at your chair this evening. The report, again, is online along with this slide presentation. So how do we promote healthy environments? You heard about our sanitarians and our offices. We have 4 sanitarians on staff along with our chief. They're responsible for going out in the community and making inspections of all of the regulated facilities, investigating all of the complaints that we receive, and you can see examples of some of those complaints in areas that we regulate: public pools, motels, salons. Food service establishments is the largest category of establishments. Complaints are a broad range of complaint. You never know when the phone rings what it might be about. Could be a housing matter. We enforce and investigate landlord-tenant relationships, insect rodent control, mosquito breeding, rat infestations. We've had recent complaints on hoarding issues, for example, that might impact adjoining properties. That's something that we would investigate. How do we support good health at each stage of life? We do have our annual influenza immunization clinics. This year, we vaccinated about 2,500 individuals within the health district, and we actually have used up all but 9 doses of our vaccine, so it's been a very successful year. This is accomplished with a great number of volunteers. We have volunteers that will actually come to your home. If you're unable to get out of your home, they'll come to your home and provide you with a flu shot in your home. We have probably 38 to 40 volunteers that help us with that program. We partner up with the local police departments, do car seat installation checks with them. It's quite amazing how these units are now installed in cars, and if you don't do it right, it's not going to work, and there's trained individuals at the police departments. We work with them. We also sell bike helmets for folks. We have a dental cleaning program available at no cost to seniors. Judy mentioned the percent of our budget that is funded by grants, and this is one area where we have a grant to help support this program. Currently, we have 7 grants that we manage to help fund the operations and services that we offer. This is a grant through the North Central Area Agency on Aging, requires a match from the health district. So for about $10,000 a year combined, we're able to offer monthly screening and cleaning clinics to individuals age 60 and older. Anyone interested in the program, give us a call and we can schedule you in. Another slide on supporting good health. A few other programs that are grant funded. This Putting on Airs program, it's a again, free program available to residents. We will come into the home with a trained inspector, usually a sanitarian, and also with a trained healthcare provider, a nurse, and evaluate conditions within the home to try to reduce asthma triggers. And this program has now been funded for a couple of years. We actually oversee this on a regional basis. We are looking for referrals. We'll take referrals from school nurses, practitioners, or others out in the community. And again, it's available at no cost. Another program that's grant funded is this Achieve initiative. And it's all about prevention and prevention of chronic disease. And if you look at the focus areas that Achieve is addressing, physical activity, nutrition, and tobacco control, if we can make a difference in those areas in people's lives, that actually will then go help us to prevent chronic illness in folks. So heart disease, stroke, cancer, diabetes, they can ideally be prevented in many cases if we can make headway in this program area. This is a coalition of volunteers that have agreed to serve on this initiative. We have an oversight committee, and representatives from all 4 towns serve on that committee. We are now entering a phase where we're able to offer some mini grants to some of the communities to address these areas. Again, a grant-funded program. We do have a part-time emergency preparedness coordinator on staff. We are responsible for ensuring that we have the local public health emergency response plan, have had that in place for many years now. We do communicable disease reporting and investigating. All the reports come into the health district, some of which need further investigation if they're a foodborne, waterborne illness, something like that, or TB. There's a picture there, actually, that's at one of our flu clinics with some of the volunteers and our coordinator helping to prepare the doses for the flu shots. We do what we call just-in-time training, so that when you arrive at the clinic, you receive that training that you're going to need to perform the role that you're going to be asked to do that day. Another slide on our emergency preparedness efforts. We conduct our clinics as if they were drills, so that in the event there were an emergency event and we need to get pills to people or vaccinations to people, we have some folks that are now experienced in registration, immunizations, the paperwork that flows with that, and so forth. We are involved in emergency preparedness activities when there's a major storm event or some other event that has impacted the community, maybe with a power outage or flooding. Recent storms last year, we were involved with inspecting shelters when they're open to ensure that they're sanitary, that the facilities are adequate, food and so forth. We're out in the community inspecting the food service establishments, particularly when the power's out. We want to make sure that establishments are not attempting to function when there's no power, to keep the refrigerated food refrigerated and so forth. Quality of service, there's our definition, if you will. Some of the actions that we've taken to improve quality within the district, you heard Judy mention our strategic plan. We're now in the third year of that plan. We publish a community health report card about every year, 18 months or so, and I've provided copies of that to the council. They are posted on our website. It's a compilation of communicable disease and other data sources, and we've been doing that for about 10 years. We use evidence-based programming for the services that we provide. We've received some training in quality improvement. We did a project this year on a quality improvement project that focused on prenatal care. We found in some data collection that the level of adequacy of prenatal care for district residents really wasn't where it should be. There was a lack of adequate prenatal care. If I recall, about 23% of the births were to moms that had not received adequate prenatal care. So we have some additional work to do in this area. We had a work group that was formed, identified some of the reasons for this, and we're hoping to address those in the future. And lastly there, you're going to see the note about the national accreditation. What's available now nationwide is a voluntary accreditation program for local health departments from an organization called the Public Health Accreditation Board, FAB for short. And we at the Health District have started our pursuit of this effort. We have appointed an accreditation coordinator within the Health District. It is our community health coordinator. We have set up an in-house accreditation team. We have board representation there also. We're working with other local health departments in the state that are pursuing this. I don't think to date anyone in Connecticut has received this designation yet because it's pretty new, but I think at least one local health department in Connecticut, there might be 2 or so more, has applied for this accreditation. We're on that path, but it's going to be some time down the road before we're ready to actually submit that application. Funding, strengthening our infrastructure. I mentioned about our grants. We have 7 grants, very successful recently with that. A couple of other projects that we're working on, hopefully soon we'll be able to present, is our online posting of the results of the food service establishment inspections. There are a lot of technical components to that we're working on to develop. I mentioned about our volunteers, and that a lot of the work that we do, particularly with our flu clinics, wouldn't be possible without our volunteers. So we're very appreciative of that. And I think Judy was going to do a wrap up.
Got a lot of change underway in the health district, and hoping that we're making a difference in the community. Looking forward, we've undertaken a project to do some really good assessment of needs out there in our 4 towns. We're working with hospitals, social service agencies, a wide variety of groups to take a look at the needs in our area. Out of this, we're hoping to develop mutually a community health improvement plan. And as we move forward to renew the next 3 years of our strategic plan, we'll be taking a lot of this data, a lot of this information to incorporate that there. We're also looking at new data sets that are becoming available to us to give us a much better information on our communities, use of new public health tools such as health impact assessments and such, and you'll be hearing more about those in the future. We're in the process of revamping our website. We've worked for quite a while now to try to get better public access to all of our services, but then all the information on our services on our website. And as Paul mentioned, our online restaurant inspection ratings are one of the things we hope to have up very soon. We're looking to become accredited as a local health agency. As Paul said, this is a relatively new process. For those of you that are familiar with this in terms of education, police, hospitals, and such, public health has come a little bit late to this. But right now, across the nation, our state health departments, our local health departments, and the tribal councils and health departments are all beginning to gear up and prepare to become accredited and such. Lastly, we've got some major change going on in terms of our leadership. Paul Hutchin, our Director of Health, is going to be retiring at the end of January. And Paul has been our first and only director since 1996. Prior to that, he had been Director of Health in Wethersfield and also had provided service for a time to the town of Rocky Hill prior to the 2 towns then coming together and forming our health district. So we're going to be missing Paul. He's really made quite a difference here in the district. And as you can see, he's leaving at a time when we've been generating, and he's been part of launching a lot of change here for our agency. Our Chief of Environmental Health, Nancy Brawl, has been appointed as the Interim Director of Health effective February 1st. So any questions, we'll be glad to answer them.
Thank you.
Oh, I'm sorry, we have one more. Thank you, Paul. Just kind of a closing reminder from our former Surgeon General, Everett Koop. Healthcare is vital to each of us some of the time, but public health is vital to all of us all of the time. We're kind of the glue out there holding things together. Thank you.
Okay, thank you.
I'd also like to say thank you for your time tonight. We appreciate the opportunity to do the presentation.
Anyone? Councilman Moriarty.
When you go to the online rating of the restaurants, is it gonna be a percentage? I know Hartford came up with one, they have one out there now. How are you gonna do that?
That's one of the pieces of the puzzle that we haven't settled on. There are a variety of options. If you look at Hartford, they have an A and a B.
Right.
If you scored 90 to 100, you get an A. 80 to 90, you get a B. And if you did less than that, you get nothing. I think they're actually going to be changing theirs, because if you go to establishment and there's nothing, you're not quite sure, did they forget to post it, or did they not earn it, or and there's lighthouses in Ledge Light, and you can earn 1, 2, or 3 lighthouses. There's others that do a 4-star type rating. So we have to settle on that part first, because when we make an inspection, there's a score, there's a number. You got a 92, but there's more behind that, and we're not sure that the 92 is necessarily what the public wants to see. They might want to see what's behind that 92 and how you earn that 92. So we might do a rating 1, 2, 3, or 4 stars, but it's going to depend on what we found at your establishment to then determine how many stars you earn. So it wouldn't be just a number. We've met a few times, and that didn't resonate with the board or the staff even, just the number. So we're probably going to do a rating, and the rating's going to be based on taking into account a number of factors. The score, what type of violation was found, and what's the risk factor or the importance, if you will, of that violation. Was it a high risk type violation or low?
Now, would there be some way for that establishment, so you go in, you do your inspection, and they had a bad day, let's say that. And they fixed it, they fixed everything they were supposed to do and whatever. I mean, are they gonna be re-evaluated, re-rated, or is that rating gonna be set for a certain period of time?
We're looking at likely starting this with class 4 and class 3s, or which are most of the full service type restaurants. And what we do there is we make 3 or 4 inspections a year, whether you're a class 3 or class 4, routine inspections. And then we'll do that follow-up inspection or that re-inspection a week or 2 or 3 after usually it's within 2 weeks of our routine inspection to see if the violations are corrected. So in the scenario you described, there would be a re-inspection, and then one of the issues we have to settle is whether or not we now change the rating on the site to reflect the re-inspection findings, or if your routine inspection findings stand until your next routine inspection. That's one of the tricky parts of this, because you can have a bad day, fix everything within a week or so, but now it's not going to be for another 3 or 4 months before you get your next routine inspection. We have to work that part out also.
Is there any liability there on your part because of this, that they could come after you legally?
Well, interesting that you say that, because we have to be assured of that also. So if we're posting something, we want to ensure that it's public information.
Right.
So most of the records that we produce are inspection records, complaint investigations. They all tie in with freedom of information and so forth, right? But the ability for us to release that information when we get an FOI request depends on the circumstances that we're dealing with. So there are times when it's not a public document yet.
Right.
So we have to be assured that once we have that report form, that it is eligible, if you will, for public release, which is what happens when we put it on our website.
Have you looked into taking this one step farther to going into places that sell, say, dairy products and stuff? You got some of these convenience stores, you know.
We regulate all of them.
But
and
are
we
you
inspect all of
also
them.
gonna rate those type of places or just restaurants?
Well, there's a couple of things to consider, because in Connecticut we have 2 sections of the Public Health Code that allow us to regulate these types of facilities. One is more for restaurants, and the other code is more for grocery stores. The grocery store regulations are different, and they don't have a classification. There's no real true form that goes with it. So I think that's going to be that would be a lot trickier. But we do inspect all of them, and we do regulate all of them. We license all of them. But the rating of them might be a little bit trickier, because they're not under the part of the code for restaurants with grades 1, 2, 3, 4, the standard inspection form, 100 points, and all of that.
I mean, maybe we can just list, if you cite them, we can list that they're cited, that's all. Some of them are a little, you go into some of these places some days, it's
Well said. Anyone else wishing to speak from the council? Councilor Cassantha?
Thank you. Thank you for your presentation tonight, and congratulations to you, Mr. Hutchinson. We wish you the best. My question is, I was a little concerned about the flu vaccine. You said you're down to the last few. Is that correct? Are you planning on getting a replenishment? Is there going to be another flu clinic offered to residents in the near future?
Right now, we have no plans for any additional clinics. I'm not quite sure you could actually get vaccine at this point. We've had calls from others looking to see if they could get vaccine from us. Right now, we have 9 doses of Flu Mist left, and that's it, out of our 2,500 and some odd order. And it seems every year we run into some difficulty or another with the flu program. Some years there's a shortage, other years there's a surplus. This year it seems as though the distribution went out right away. We got our vaccine in September, and which was fantastic. It usually doesn't happen that way, but it seems as though the shipments all went out, and now the trick is to find out who has it.
Okay, Thank
and
you.
who's holding extra if we needed it. The good news is right now we're getting weekly updates from the state. You can actually go on the state website and see the status of seasonal flu in Connecticut and the peaks and the valleys as compared to prior years. And right now we're still at a very moderate level, sporadic almost you might call it, so it hasn't really peaked. We're prepared if we had to get back into this if we needed to. But the question would be whether we could find the product, find the vaccine.
Okay, thank you.
Anyone else wishing to speak? Hearing none. Thank you for your
Thank you very much.
participation.
Thank you.